University Hospital, as many of you know. Why are we here? We're here to make certain that this hospital, this university, is available for a resource. We're here equally as much to dispel myth. We're also here to information share and to strategize together as a group. Despite the urban myth, no, closure is not on the table. Despite the urban myth, cannibalizing the labor is not on the table. Despite the urban myth, walking away from our commitment is not on the table. That being said, I'd like to ask Provost Rogers to offer to the Board of Directors and the Board of Trustees a contemporary update of the financial status of the university in the context of the University Hospital. Provost Rogers.
Thank you, Dr. Owen. Is this on? Thank you. I think what I would like to attempt to do is to provide an understanding of our current situation, how it is we got here, and then to discuss some of the potential options that we may need to implement if indeed our financial status doesn't improve. First slide. It's important that we understand the historical context of how we got to this place. And I think that we need to go back about 40 years when the state and the city agreed to, and the university made a decision to remain here in Newark, in part to meet the healthcare needs of the population in Newark, but specifically to meet the healthcare needs of underserved populations in the city of Newark. We created a unique entity, an academic health center, a partnership between the medical school, the dental school, and the hospital, with an emphasis on providing both high-quality education to healthcare professionals and patient care. In addition, we had an obligation to provide service to the community and to conduct research, something that an academic health center does in an attempt to actually improve the overall outcomes of the patients that we serve. The state of New Jersey recognized the importance and the value of both the academic and safety net missions of the university by providing historic financial support for these missions. Next slide. The state financial support began in the early 70s and lasted continuously until 1998. From 1988 to 1998, we averaged $33 million a year in support from the state in recognition of the academic and safety net missions of the university and university hospital. When this funding ended, for the past 10 years, the university has supported these missions. We have not changed our mission at all during that period of time, in spite of a significant decrease to the tune of probably close to $300 million over that same time period. Next slide. A very brief reminder, obviously, for our trustees. You know this and know this well, as does the Board of Directors for University Hospital. One thing I do want to remind us, however, is that University Hospital is different from every other hospital in the state of New Jersey. There is no other hospital that is as integrally linked to the academic mission. We are an academic health center. Anything that adversely affects the hospital has a significant adverse impact on our students and the training of future healthcare professionals who will serve the citizens and residents of the state of New Jersey. Next slide. I want to also add that we are the largest safety net essential hospital in the state of New Jersey. But in addition to that, it's important to note that because we are an academic health center, we are able to provide cutting-edge quaternary and tertiary care services. The things you see up here, the kinds of cutting-edge services that we provide, are directly linked to the fact that we are part of an academic health center, and therefore serve a broad range of patients for a broad range of problems. Next slide. The financial outlook for the university right now, however, is not sustainable because of the university hospital financial crisis. We have a multi-year accumulation of deficits at the hospital that have threatened the credit worthiness of the university as a whole. Because we are one entity, when the hospital is in trouble, the university is in trouble. And as all of you are well aware, our credit rating has been downgraded on several occasions, unfortunately, and we are now in significant trouble related to our credit worthiness in this particularly unstable market, which makes our situation even more tenuous. The safety net mission of University Hospital, unfortunately, cannot be sustained without enhanced and continuous financial support from the state in recognition of our unique role as an academic health center, the only academic health center in the state of New Jersey. Next slide. When we talk about the amount of charity care that we provide, it's less important that you understand the numbers themselves, but more important that you understand what these bars represent. The blue bars on these slides represent the amount of charity care that we provide at University Hospital. The yellow bars represent the amount we get reimbursed by the state of New Jersey for that care, and the red bars represent the gap in that amount. It is important that we note that no hospital in the state of New Jersey is reimbursed for all of the charity care they provide. We don't have that expectation. The difficulty for us, however, is because we provide disproportionately so much more charity care than many other hospitals do, this shortage has a significant impact on our bottom line. So that if you look at where we're headed for fiscal year 08, it appears that we have close to a $32 million shortfall between the amount of charity care we provided and the amount that we were reimbursed for. Next slide. What that means is that if you look at the losses over the past 9 years, you see that UMDNJ has contributed, basically, has covered, if you will, $173 million of costs to University Hospital because of a lack of appropriate resources for the hospital. Next slide. What's the reason for that? The primary reason is that 75% of patients that come to University Hospital have charity care, self-pay, or Medicaid. And all of these payers pay significantly less than the cost to us of providing care. What I can assure you without question is there is no other hospital in the state that has this payer mix and that does not require substantial subsidy in order to survive. What I can also tell you is that any other hospital that had the financial crisis that university has had during these past years, without being connected to the university, those hospitals would have closed a long time ago. It is because of our commitment to our mission, to the patients that are represented in that mission, that this university has given the kind of resources that we have in order to ensure that University Hospital survives. Unfortunately, we cannot continue to do that. Next slide. Why now? The major reasons you see on this slide. We have bond refinancing due in 2009, again in an environment where our credit rating has been downgraded, so the cost of borrowing money for us is significantly greater. The other pressure is this continued need to support University Hospital's operating deficits. Again, as you know, we are anticipating that University Hospital will end this year with a $23 million deficit. That's a significant improvement over the $50+ million deficit that we ran last year, but still raises significant concerns for us. We had costs associated with the federal monitor, and quite frankly, at the end of the day, the university's operating expenses, including our labor expenses, expenses for supplies, have all increased over the last several years, while many of our sources of revenue have not increased. Next slide. I don't want to go into a lot of detail about the bond refinancing, except to say that number one, it's a highly technical issue, but number two, it is a critical issue for the stability and sustaining of this university. If we are not able to get some stability related to our $95 million in bonds that have to be refinanced by the end of January, we will face potentially having to repay those bonds, and that will create a significant fiscal crisis for the university as a whole. Next slide.